Hello, Mr. Jones. My name is Sandra. I'm one of the nursing students at NTC. How are you today? Good, thank you. I'm here because the physician had ordered a dressing change on your central line because one of the corners was starting to peel back slightly. So I'm going to complete that right now. Have you had your dressing changed before? You have? Okay, so you're familiar with the process? All right, good. First, can you please confirm your name and date of birth? And he does, thank you very much. Do you have any allergies or any sensitivity to iodine? You don't, okay, great. Sorry, let me just pull a little more. So I already have my supplies here. And we're gonna do the same thing as before. I'm gonna peel back that transparent dressing and apply a new one on. And I'm also gonna clean the site while I'm doing the dressing change. So that will require a sterile procedure, which means you'll need to wear a mask. Is that okay with you? It is, okay, very good. So I've confirmed the order in the MAR. I am going to clean my hands since I touched my face, so I'm gonna clean my hands. Hands are clean. All right, so let's go ahead and put your mask on. I have all my supplies here ready. My dressing change kit, my sterile gloves, extra clean gloves, hand sanitizer. And I'm also visually inspecting the area right now because it's a transparent dressing, so I'm looking through to see if I see any signs that is pulling out, looking for redness, swelling, if there's an amount that is present for fluid or any sort of discharge. So my hands are clean. Got that set. Clean my hands again. Okay, put on clean gloves. And I'm looking from hub to insertion site to see if there's any signs of, anything that would be different from what was reported in the MAR by the last nurse. And as I pull this, I'm going to pull from the corners towards the insertion site. I never want to pull away from the insertion site. And I'm going to just gently hold these still to make sure while I'm pulling this, because it's extremely sticky, that I'm not going to be pulling it all on the insertion site itself. So being that this Chester model has been used a few times with this, this site is excessively sticky, but I would just know that this would not be normal for skin to have, this much stickiness and difficulty or it constantly tearing apart. But if that was happening, and I'm always pulling towards the insertion site, then I would just want to make note of that and see if there's a different type of bandaging or something that we should be using, and make sure I get every tiny little piece off, and while I'm doing that, making sure I'm not touching the insertion site with my clean gloves. Okay, and I realize I'm pulling away right now on this piece of skin, but again, that's just due to the model itself being so incredibly sticky from all the dressing changes. Okay, now that it is off, I'm inspecting my site again for Rita, and I'm also looking at the site to make sure that I don't see anything that would be of concern before I complete the dressing change. Okay, clean those off, clean my hands. And I'm going to prepare my sterile field. Open up my kit, make sure I can visually see all the supplies that I would need. Put on my sterile gloves. Packaging is ready, my hands. Okay. And the first thing I'm going to do is take my alcohol prep or swab, and I'm going to clean immediately around the site. pull this slightly closer with my foot. Grab my tweezers. This up, and I'm just swabbing all the way around a circular motion around the insertion site according to agency policy. Drop that in my trash. Grab my blood prep. Activate it by squeezing. Make sure it gets wet at the end. Once I see that the activation is filled in the sponge, now I can scrub vigorously on all 4 sides for greater than 40 seconds or according to agency policy. Doing okay, Mr. Jones? Mask is okay? Okay, great. I can set that down. I have scrubbed for 30 seconds or according to agency policy. Now my skin prep would be wiped on if it is required according to agency policy. And in between those things, I would be letting it dry. So it's had time to dry. My skin prep is dry. Now it's time to put on the new transparent dressing. I have that here. Place that over top my insertion site, pushing it out towards the edges, removing the outer piece, making sure everything is secured down tightly and according to agency policy. Okay, everything is secured as required according to agency policy. And now that it is covered, I could set this down. I can take off my sterile gloves, take off our masks, wash my hands, remove my excess equipment, and now if I need to, I could take the label off of the end of the dressing, transparent dressing, and I could label the side with the time, date, my initials. Make sure my patient is comfortable, bed's at a comfortable height, has the call light. Alterations across lifespan would be pediatrics. It might need some extra securing in case they try to pull at it or if it's uncomfortable for them. Geriatrics, we might need to be cautious about what type of adhesive bandages that we're using because they have more sensitive skin and are more likelihood of having skin tears. And I would wash my hands, go to the MAR, document the dressing change, COCA, Rita, anything that was, abnormal about the dressing site or change, and make sure I document the time that I completed as well. Wash my hands again, done.